Okay, so tonight I want to just kind of elaborate a little bit more on some of the things I talked about in my last video about sarcoidosis. Um, so yeah, I mentioned that uh, you should definitely any person at all, not just black people. Any logical person should uh, get a physician or become acquainted with a physician or create a patient doctor relationship with a physician that they can trust. Now, I will say that, other groups of people, um, some of the things that influence, you know, uh, some of the diseases, disease processes rather, that occur in black people, other people kind of don't have to deal with because, you know, most of the medical population is white and Asian, and you know, I feel like I think the last time I checked, only like 3% of all practicing physicians are black. So black people kind of have to deal with what they can as far as that. And I'm not suggesting that all white and Asian and Hispanic or non-black physicians are untrustworthy when it comes to black patients, but um, I found through my experience that uh, in a in an environment like medicine where there are a lot of uh, non-black people who um, either don't understand black illnesses or don't understand the impact of social status of black people on their health, or just don't care or know, but they actively do things a certain way to make the disease process, even worse, or don't help them on purpose. So um, I would say that the best way to bypass that is to go ahead and, if you are a black person, try to find you a black physician. Um, and black physicians. I think I sort of mentioned in the last video that that oftentimes we need a physician team, especially if we have diseases or something. Of course, you need a primary care doctor. That's just for checkups, and when you first feel like something's wrong, you go to them first, and then they kind of refer you to other people. But you can find black people in all areas. I know black dermatologists. I know black ophthalmologists. I know black neurosurgeons. Actually, black. There's a black physician. Doing in every field. So it's not like um, even though they are scarce and widespread, they're not non-existent like it may be portrayed. So I mean, I would take that how you want, but you know that's just my suggestion on how to bypass sort of the racial aspect of um the racial implications of health, because oftentimes the fact that you're black doesn't necessarily mean that you're more genetically predisposed to certain conditions, which there are diseases that have been sort of found to have a genetic pattern in black people, like sickle cell. Um, but there's not a lot of them actually that I can think of. Off the top of my head, the only one I can think of is sickle cell. Um, but like as far as like different types of cancers, different types of hypertension and sarcoidosis, like we talked about, and other diseases like that. There's a lot of research to suggest that those diseases come about as a product of a certain environment, and a lot of black people live in poverty. A lot of black people live under a lot of stress. um, and I'll talk more about that in other videos, but there's a lot of environmental factors that black people have to deal with in large numbers that other races of people just don't have to deal with in large numbers. So I feel like it's important to get a physician that understands uh, those factors and understands kind of, and I would say, based off of, what I know and where the experience I've had, um, a lot of black physicians know that there are a lot of racist people in the medical field, and while a lot of them might not outright say, okay, uh, you know, like, you're wrong for, like a lot of them, they're not going to be outspoken about it. They're not going to really talk about these things that I'm talking about with you, and, for a good reason. There's a lot, I know for a fact, there's a lot of retaliation in any field where you have racist people. Um, when people speak out, for the good of the people that are being oppressed or being, harmed, it's usually, they get ganged up on by the bad people. So yeah, so they, a lot of them might know, they know a lot of the things that I'm telling you. It's just they're not going to say it. It may be out of fear, and that's kind of my point of starting this discussion, like to try to get, more insight from the community or from, everybody, maybe, like trying to get some ideas to try to see if we can like fix this broken system, because right now there's a lot of bad things going on that a lot of people aren't going to talk about, and that a lot of people, well, most people outside of the medical field don't even know about. So that's why I have these discussions. So hopefully people can give insight and give ideas so we can, come to a conclusion or come to a solution rather. But um, yeah, I wanted to elaborate on why I mentioned to get a physician that you can trust. And also, so if you look here, I have a diagram set up. Um, I'm not sure if it'll be cut off when I upload the video or certain parts, but basically at the very top, it's split in half about society and individual. And it's kind of a confusing diagram, but this is really the only one this is the one I could find from looking for the social implications of health. Um, and this is from the CDC. I kind of don't like the CDC, but especially now that Trump's in office, there's actually been a lot of changes to some of the statistics from CDC sources, which is very interesting since he's been in office. But yeah, so this graph basically kind of talks about it doesn't really even like make it clear, like um but the main thing is that it's been mentioned before that social status has a huge implicate like a huge effect on health and wellness. Like that's not something I'm making up. That's not something, that I, like just, I don't know. A lot of times when people talk about things that aren't really that much talked about, um the assumption is that they're making it up. The assumption is that they're taking something out of context, or they're, overreacting to something, and it's not. That's not it here. I just wanted to show you guys, this is a graph from the CDC, showing that even they, believe that social status, and they say by race and class here, um has an effect on health. So um and I also encourage all of you to be researchers. Like, research, if don't know what I'm talking about or don't believe in what I'm talking about, go look it up. It's I'm not giving you anything new or making up anything. I'm just trying to start a discussion over things that kind of need to be brought into the forefront. Like, these are well-known things in the medical community, but the everybody else doesn't really know about it, that I've seen. Um but yeah, uh make sure you guys comment and rate, subscribe to the channel. Let me know how your ideas on things, or if you want me to talk about a certain topic, let me know. If you want to just give me some feedback, let me know something. Somebody is outside my apartment here. One moment, please. But yeah, comment, rate, subscribe, send me messages, let me know if you want to talk about something, or if you want to see me do a discussion on something else. Let me know. There was something else I wanted to bring up in tonight's discussion. I feel like I made my point basically about getting a black doctor. There's other things, yeah, if you are in a certain area, like different different places have like different websites for like where you can find black doctors. um in the Houston area, I know in Houston, Texas, they have like the Houston Black pages, where you can like find black restaurants, um black other businesses, and of course black physicians on that website. It's a good place for black people to connect, and people to find black owned and operated areas and things like that. But um I will be back probably next week or so, or if not next week, probably day after tomorrow with another video. Um but until then, I hope you guys have a good night, and see you later. Or not see you later, but talk to you later.